Type of diabetes and how to prevent it. Diabetes is a chronic medical condition that affects how your body processes glucose, sugar, from the food you eat. There are several types of diabetes, each with distinct characteristics and causes. Preventing diabetes involves adopting a healthy lifestyle and reducing risk factors. Let's explore the types of diabetes and strategies for prevention. Types of diabetes. Type 1 diabetes. Cause. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. The exact cause is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Characteristics. Type 1 diabetes typically develops in childhood or adolescence, and individuals with this form of diabetes require lifelong insulin therapy to manage blood sugar levels. It is less common than type 2 diabetes, accounting for about 5–10% of all cases. Type 2 diabetes. Cause. Type 2 diabetes is primarily characterized by insulin resistance, where the body's cells do not respond effectively to insulin. Genetic factors, obesity, sedentary lifestyle, and poor dietary choices play a significant role in its development. Characteristics. Type 2 diabetes is more common and often develops in adulthood, although it is increasingly diagnosed in children and adolescents due to rising rates of obesity. It can be managed with lifestyle changes, such as weight loss, healthy eating, and exercise, and may also require oral medications or insulin. Gestational diabetes. Cause. Gestational diabetes occurs during pregnancy when the body cannot produce enough insulin to meet the increased demands. Hormonal changes during pregnancy contribute to insulin resistance. Women with gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Characteristics. This type of diabetes usually resolves after pregnancy but increases the risk of complications for both the mother and the baby during pregnancy and childbirth. It can be managed with dietary modifications and sometimes medication. Preventing diabetes. Prevention strategies for diabetes, especially type 2 diabetes, are primarily centered around adopting a healthy lifestyle. Here are some key measures for diabetes prevention. Maintain a healthy weight. Achieving and maintaining a healthy weight through a balanced diet and regular physical activity is one of the most effective ways to prevent type 2 diabetes. Excess body weight, especially around the abdomen, is a significant risk factor. Healthy eating. Consume a diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats. Limit your intake of sugary beverages, processed foods, and foods high in saturated and trans fats. Regular physical activity. Engage in regular physical activity, including aerobic exercises, such as walking, jogging, and swimming, and strength training. Aim for at least 150 minutes of moderate intensity exercise per week. Portion control. Pay attention to portion sizes and avoid overeating. Smaller, balanced portions can help manage your calorie intake and blood sugar levels. Reduce sugar and refined carbohydrates. Limit your consumption of sugary snacks, sweets, and sugary drinks. Reducing refined carbohydrates, white bread, white rice, can also help stabilize blood sugar levels. Stay hydrated. Drink plenty of water and avoid excessive consumption of sugary and high-calorie beverages. Quit smoking. Smoking is a significant risk factor for type 2 diabetes. Quitting smoking can help reduce your risk of developing the disease. Moderate alcohol consumption. If you choose to consume alcohol, do so in moderation. Limiting alcohol intake can help manage blood sugar levels. Regular checkups. Visit your healthcare provider for regular checkups and screenings, especially if you have risk factors for diabetes. Early detection can lead to timely interventions. Stress management. Chronic stress can contribute to insulin resistance and elevated blood sugar levels. Practicing stress reduction techniques like meditation, yoga, and deep breathing can be beneficial. Screening for gestational diabetes. If you are pregnant, attend prenatal care appointments and follow your healthcare provider's recommendations for gestational diabetes screening. Medications. In some cases, individuals at high risk of developing type 2 diabetes may be prescribed medications such as metformin to help prevent the condition. This approach is typically reserved for those with specific risk factors and under medical supervision. It's important to note that while these prevention strategies can significantly reduce the risk of type 2 diabetes, they do not guarantee prevention in all cases. Some factors, like genetics and age, are beyond your control. Therefore, regular medical checkups are essential to monitor your health and manage diabetes risk. If you have concerns about diabetes prevention or management, consult with a healthcare provider or registered dietitian for personalized guidance. Thanks for watching. Subscribe for more video like this.